When daily reflux medication is no longer enough, doctors sometimes discuss a surgery called Nissen Fundoplication. Reflux happens when the muscle valve between the stomach and food pipe weakens, letting acid flow backwards. A hiatus hernia, where part of the stomach slides up through the diaphragm, often makes reflux worse. Surgery is considered when medication fails, symptoms persist, or a large hiatus hernia is causing problems. Before surgery, doctors usually confirm reflux with endoscopy, pH testing, and manometry to measure esophagus muscle function. Most operations today are done by keyhole surgery, 4 or 5 small cuts, a camera, and thin instruments. In a Nissen, the surgeon wraps the top of the stomach fully around the lower esophagus, creating a new valve. Partial wraps, like the Toupet, cover about 2/3 of the esophagus and are gentler on swallowing. Most people go home within 1 to 2 days after keyhole surgery with some upper abdominal discomfort. Eating restarts in stages. Clear liquids first, then soft foods, and a normal diet by around 6 weeks. In the early weeks, difficulty swallowing, bloating, and trouble burping are common and usually improve with time. Risks include persistent swallowing difficulty, gas bloat syndrome, slipping of the wrap, and, less often, recurrent hernia. Long-term studies show most patients maintain good reflux control for years, and many stop daily acid medication. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.